Yes, ma'am.
I noticed you were saying about lower immunity.
Yes.
Some patients you have to try to activate their immune system.
Mm-hmm.
So does cancer like thrive on low immune system? Because with the medication that I'm taking for rheumatoid arthritis, lowers my immune system. So am I at a higher risk?
I don't think so. I think it's kind of like the age-old question that patients ask me when they come into the office, which is, if I eat sugar, is it going to feed the cancer? It's just not that simple as that, because the pathways I mentioned here, there's so many checks and balances. There's so many activators, inactivators. It's so you are at risk for some lymphomas. Okay? Anyone who has an impaired immune system is at risk for some lymphomas. But there's really no data that says you're at higher risk of solid cancers. And what these treatments that I mentioned on the slides, what they're trying to do is this. When a cancer that's trying to evade the immune system from attacking it, it upregulates certain proteins that basically say, chill out, immune system, don't mess with me. And what this treatment does is only when the tumor upregulates this stuff, it blocks that. So it hopefully is not going to cause huge changes in your own body's immune system. So in your situation where your immune system is down some, I don't think it's going to increase your risk for solid tumors, but it could increase your risk for some of the lymphomas and white blood cell tumors. But it's a low risk. Yes, ma'am.
Just a question about the CTs. That was one. I was getting regular 6-month CT, at least extensive treatment.
Yes, ma'am.
Very extensive. Now I've just been diagnosed with MAC, but they're taking the approach not to treat it and not regular CTs. So I guess I'm sort of wondering, based upon that, is someone's risk greater to develop something when you have these things in there like at all times?
So what she's mentioning is two separate types of
Exactly.
infections, one called MAC and one called nocardia. And in a compromised immune system, you can get some of these atypical respiratory infections, and some of them are really hard. I don't know all the ins and outs of your case, but I will tell you this: the treatment for MAC is very toxic, and that may be the reason why they decided not to treat it.
Exactly.
Right. So, kind of to her question, which is, if your immune system is down, are you more prone to get cancer? I don't think it's as simple as that. But for you, you're definitely at risk for these opportunistic infections.
Oh.
And so I think what they're probably realizing is that's more your risk than anything else. And if doing a scan in 6 months isn't going to change your management, don't put you through the radiation exposure. Is that the answer?
Yeah, this is what we were thinking.
Yeah.
If you're not getting routine, they would never have found the mass on the right.
Right, and so many cancers that are found incidentally. If you guys follow Ruth Bader Ginsburg, she had colon cancer, Supreme Court Justice. She had colon cancer. She went in for a scan, and they found a mass on her pancreas. That's how she was found to have stage 1 pancreatic cancers, because she had a scan for colon cancer.
But this has been real helpful about the screening, maybe to talk to mine.
What I can do is, it may be helpful if y'all haven't had someone to speak, would be someone, one of the thoracic surgeons or one of the pulmonologists, to come and talk to you guys about that whole lung cancer screening.
That'd be terrific.
I think that's a good idea, because, I don't want to muddy the waters by saying stuff that I'm not an expert in. I just know that there are clear guidelines like many things, and since I don't do it on a day-to-day basis, because unfortunately that's just not what I do. I'm not seeing primary care folks, and I'm unfortunately seeing patients after they already have a diagnosis. It's not something that I do on a day-to-day basis, but I think this would be quite helpful for the audience to sort of know what's the ins and outs of this lung cancer screening recommendations.
Do you have somebody you work with?
I'll find somebody. I'll find someone for you.
That'd be terrific.
Yeah.
I just have one other quick
Sure.
question. When you were talking about that, the mutation
Yes, ma'am.
in the Asian, that was Asian women, correct?
That's the group that was found to have the highest chance of having this mutation. Yes, ma'am.
Okay, so if, say, the Asian woman had the mutation,
Uh-huh.
could that mutation have been passed on to a child?
No, these are all somatic mutations. I mean,
Okay.
they didn't inherit them.
Okay.
It's just something about it's something about the environment, just the milieu they live in, and and some of it does have to do with some tendency maybe to, it's not a one-to-one. Maybe this is ongoing research trying to figure out why that is. Is it something about their genetic makeup that they inherited that makes them more likely to get this mutation?
I was just wondering, because my husband was also part Asian, and he was just so young to have
Well, the thing
been
about it is,
diagnosed with that type of cancer.
anytime someone gets a cancer at an early age, you always got to bring up the possibility that it was inherited. I had a patient when I was practicing oncology in Tennessee who was my age, and that was 5 years ago, who had stage 4 lung cancer. You just got to think either there was something he inherited or just really bad luck that just the wrong set of circumstances where he had a mutation here, a mutation here, a mutation here, all in the wrong place.
Well, his sister had it too. That is what
Yeah.
made me worry. And she had it. They were 3 years apart, and she had it at 40. She had it at 44.
Okay.
And he had it at 46.
The one thing I will tell you is that at Thomas Johns Cancer Center, where I spend most of my time, they have, through that, at Johnson Willis, there are genetic counselors to help with patients. The contact is usually through the surgeon, because a lot of these are breast cancer things, but they're open, something you can inquire about at Thomas Johns about, should we look at the family tree and see if there's something to these cancers.
Thank you.
Any other questions?
All right, I gotta get back to
You
it.
gotta go.
I gotta go.
Page.
All right.
Thank you so much.